Hi guys, good morning. Myself Dr. Ravi Patel, Assistant Professor at JJHMC in Department of Practice of Medicine. Today we are discussing about the few topics of CVS. The series of Practice of Medicine with Dr. Ravi Patel. The first topic of CVS, that is regarding the anatomy and physiology of the heart. So we are starting with the basic structure of the heart. You guys are studied in anatomy about the basics of the heart. Let's revise. The heart is a hollow muscular organ and it is approximate 12 by 9 centimeter in size and 250 grams in females and 300 grams in males. So while we are starting the structure of the heart, let me introduce the parts of the heart. Here we all are knowing about the heart has the four chambers. First, that is a right atrium. The second one, that is a right ventricle. Third one, that is left atrium. And the biggest chamber of the heart, that is a left ventricle. Now, right atrium and right ventricle, so both are connected with the one valve, that is tricuspid valve, and left atrium and left ventricle are connected with the mitral or bicuspid valve. So here heart has four chambers: right atrium, right ventricle, left atrium, left ventricle. Now the heart has a one cushion like bag like structure that protect the heart, that is pericardium. Surrounding of the heart is covered with the pericardium and pericardium is filled with the fluid. So the connection of the various type of the veins and arteries. So here it is the superior vena cava, here it is a inferior vena cava, that both are opens in the right atrium. In right ventricle, there are the opening of the pulmonary arteries. In left atrium, there are the pulmonary veins which are giving the blood or drain the blood into the left atrium, and in the left ventricle pumps and push the blood through the aorta. Here it is the aorta. Here are the branches of the aorta: superior vena cava, inferior vena cava. So we are started with the circulation of the heart. We all are knowing about the whole the body collect the blood through the veins and drain into the two main veins, that is superior vena cava. Here it is a deoxygenated blood. Deoxygenated blood drains from the all over the body into the two main major veins, that is superior vena cava and inferior vena cava. Here the deoxygenated blood I am showing with the blue marker. The blood comes from the superior vena cava and inferior vena cava. Here inferior vena cava opens at the right atrium. So right atrium filled with the deoxygenated blood and passes through the tricuspid valve into the right ventricle. Here again, superior vena cava, inferior vena cava, both are collecting the deoxygenated blood and drain into the right atrium. Now right atrium has the one barrier, one valve, that is called as tricuspid valve, and tricuspid valve opens and whole blood drain into the right ventricle. Here, right ventricle has deoxygenated blood, and these deoxygenated blood are while the contraction of the right ventricle, the deoxygenated blood travels through the pulmonary valve. Here it is a pulmonary valve, and travel to the pulmonary valve, go to the pulmonary artery. Now, surprisingly, pulmonary artery is the only artery who having the deoxygenated blood. Remember, pulmonary artery having the deoxygenated blood. While we are studying in our medicine, the artery has to be oxygenated blood, but here pulmonary artery having the deoxygenated blood, and pulmonary artery drain to this deoxygenated blood to the lungs, because its name suggests that pulmonary artery, and pulmonary artery drains the blood into the lungs. We all are knowing the process of oxygenation into the lungs, CO2, O2, CO2 exchange process in the lungs. So while O2 CO2 exchange happens and the pulmonary veins, here again a twist, pulmonary veins drain the oxygenated blood. Here are the four type of the pulmonary veins, that are 1, 2, 3, 4, that are drain the oxygenated blood from the lungs into the left atrium. So left atrium, now left atrium has oxygenated blood from the lungs. So via mitral or the bicuspid valve. Here is the here right sided tricuspid valve, left sided mitral or the bicuspid valve. So bicuspid valve opens and drain whole the oxygenated blood into the left ventricle, the biggest chamber of the heart and the strongest chamber of the heart. So left ventricle collects the whole blood from the left atrium via mitral valve with the opening of the mitral valve, and into the left ventricle the oxygenated blood pumps. By the contraction of the left ventricle, the oxygenated blood pumps and travel to aorta. Here it is the aorta, and the oxygenated blood travel through aorta. This is the aortic valve. So in aorta, oxygenated blood travels, and from behind the heart it goes downward and supply all over the body. So again we are quickly revise the circulation of the heart. So deoxygenated blood from the body collected via inferior vena cava and superior vena cava here, and drained into the right atrium. With the opening of the tricuspid valve, it goes into the right ventricle. From the right ventricle, the deoxygenated blood travel into the pulmonary artery, and pulmonary artery that goes to the lungs. And in the lungs, O2 CO2 exchange happens, and deoxygenated blood converts into the oxygenated blood. And oxygenated blood from the lungs, they are with the help of pulmonary veins. There are four types of pulmonary veins. They opens into the left atrium. Here we have oxygenated blood. So oxygenated blood came into the left atrium, and through the opening, with the opening of the mitral valve or the bicuspid valve, they enter into the left ventricle, and with the pumping of the or the contraction of the left ventricle, the blood goes with the flow of aorta. They circulate all over the body, and the oxygenated blood came to the each and every cell with the help of this type of circulatory system. So it is a quick review or the quick reminder